Assalamu alaikum. Hello, everybody. I am Abdul Qasim. Today, me and my friends will talk about traumatic injury to the thorax, and this is our objectives. Number one, brief anatomy about the thorax. Number two, brief physiology about the thorax. Number three, intro definition of the thorax injuries. Number four, classification of the thorax injuries, and number five, diagnosis of the thorax injuries. Number six, complication of the stab wound in the thorax. Number seven, treatment, surgery of the thorax injuries. Number eight, first aid for thorax injuries. And number nine, conclusion. And I will start with a brief anatomy about the thorax. Introduction: the thorax is region between the abdomen inferiorly and the root of the neck superiorly. It forms from the thoracic wall. The superficial structure, burst, muscles, skin, and the thoracic cavity. Thoracic wall consists of the soft tissue and skeletal part. Soft tissue, it has muscles, connective tissue, and it is skin covering. Skeletal part has a cartilage and bones. Thoracic bony wall formation: posterior, anterior, lateral, and inferior. Posterior thoracic part of the vertebral column, anterior sternum and costal cartilage, lateral ribs and intercostal space, and inferiorly diaphragm. We see in these pictures thoracic wall is formed by 12 ribs, 12 thoracic vertebrae, cartilage, sternum, and 5 muscles. It functions in movement, respiration, and protection of the thoracic cavity. The thoracic vertebral bodies and intervertebral disc make the posterior thoracic wall. The first 7 true ribs articulate with the sternum inferiorly. Alt ribs 8 to 10 have a cartilaginous extension to the communicate with the sternum, while floating ribs 11 and 12 do not communicate with the sternum, forming the bony framework of the thoracic wall. Thoracic cavity. Thoracic cavity is found deep to the thoracic wall, superior to the diaphragm, and inferior to the root of the neck. The thoracic cavity contains organs and tissue that function in respiratory, like lungs, bronchi, trachea, pleura, cardiovascular, heart, pericardium, great vessels, lymphatics, nerves, vagus nerve, sympathetic chain, phrenic nerve, recurrent laryngeal nerve, and immune system, thymus, and digestive system, esophagus. And can typically be divided into well-established compartments, primarily the pleural cavity and the mediastinum. Also, there is 2 pleural cavity, which respectively contain the left and right lungs and pleura. The mediastinum is central and found between the bilateral pleural cavity. The mediastinum extends to the inner border of the sternum, anteriorly the inner border of the thoracic vertebral bodies posteriorly, and spans the full vertical length of the thoracic cavity. Gross contents of each mediastinal compartment are as follows: lower cavity, superior mediastinum, interior mediastinum, medial or middle mediastinum, and finally posterior mediastinum. Lower cavity has a lungs and pleura. Superior mediastinum has a great vessels, trachea, esophagus, vagus nerve, phrenic nerve, sympathetic nerve, thoracic, lymphatic duct, and thymus. Inferior mediastinum, connective tissue, thymus, and lymph nodes. Middle mediastinum, heart, root of the great vessels, phrenic nerve, and pericardium. Posterior mediastinum, descending aorta, azygos veins, esophagus, vagus nerve, sympathetic nerve, bronchi, and thoracic lymphatic duct. I think I finished all the anatomy about thorax. Thank you for listening, and
Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Mohammed Al Araini. We're going to talk about brief physiology of the organs in the thorax. We know that the pleural cavity is filled with fluid which acts on as a lubricant. It's covered by two layers, which is the parietal pleura and the visceral pleura, and it lubricates the lungs. Lungs are the foundational organs on the respiratory system, so they facilitate the gas exchange. To be more specific, the oxygen and the carbon dioxide. Uh, we're going to talk about the heart and how the blood goes in and out. Now, heart pumps the blood throughout the whole body via the circulatory system. Uh, so the blood either comes from the neck and head through the superior vena cava, or comes from beneath through the inferior vena cava, entering the right atrium, then from the right atrium to the right ventricle, going through the pulmonary arteries to the right and left lungs. And after the exchange happens, they come back through the pulmonary veins, uh, going to the left atrium, then to the left ventricle, then they go through the aorta, and they reach the aortic arch, where the blood either goes through the subclavian arteries and supply the upper limbs and the head and the neck, or it goes to the descending aorta, supplying the inferior limbs. We have the diaphragm, which is a muscle, dome-shaped muscle that contracts rhythmically and continuously, and most of the time it is involuntary. Upon inhalation, the diaphragm contracts and flattens, and the chest cavity enlarges because of the negative pressure that has been made by the diaphragm when it flattened, causing the air to go through the trachea, then to the bronchis, to the primary bronchis, then to the secondary, then the tertiary, eventually reaching the uh, the alveoli, where the gas exchange will happen. And thank you.
Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Muhammad al-Shihri, and today I will talk about thorax injuries. First of all, thorax injuries or chest injuries are often serious or immediately life threatening because they interfere with breathing or circulation. Chest injuries most often affect the ribs, upper part of the abdomen, lungs, blood vessels, heart, muscles, soft tissues, and breastbone. Sometimes the esophagus, collarbone, or shoulder blade is also injured. Many of the injuries that can cause death during the first minutes or hours after injury can be treated or stabilized in the emergency department without the need for major surgery. The chest can be injured by blunt force, such as motor vehicle crashes, falls, or sports injuries, or by an object that penetrated, such as bullet or knife. And also, chest injuries can cause circulatory problems if they result in a lot of bleeding. Some injuries damage the ribs and chest wall severely enough to make it difficult for the lungs to inflate normally, as we can see here in the picture. Damage to the lungs themselves interfere with gas exchange, which is the main function of the lungs, in which oxygen is acquired and carbon dioxide is expelled. Common chest injuries. There are many examples like blunt injury. Blunt injury of the heart is blow the chest that bruises the heart muscles, tears the heart's wall, or damage heart valve. Cardiac tamponade, which is pressure on the heart caused by accumulation of blood around it. Hemothorax, which is blood between the lung and chest wall. Pulmonary contusion. Pulmonary contusion is bruising of the lung and rib fractures and injury to the aorta, which is a tear in the large artery that carry blood from the heart to the body. And many other examples like traumatic pneumothorax, which is air between the lung and chest wall, and sometimes called collapsed lung. Thank you.
Assalamu alaikum warahmatullahi wabarakatuh. My name is Suud bin Talib, and today we'll talk about classification of thorax injuries. First, we'll talk about rib fracture, hemothorax, filial chest, pulmonary contusion, and finally, we'll talk about cardiac tamponade. Rib fracture is a break in a rib bone. This is typically results in chest pain that is worse with the breathing in. Bruising may occur at the site of the break when several ribs are broken in several places. A filial chest results. Potential complications include pneumothorax, pulmonary contusion, and pneumonia. Most common chest injury may interfere with ventilation and may lacerate underlying lung. Hemothorax, derived from hemo, like blood, thorax, like chest, pleural hemothorax is an accumulation of blood within the pleural cavity. The symptoms of hemothorax may include chest pain and difficulty breathing, while the clinical signs may include reduced breath sounds on the affected side and rapid heart rates, and blood in pleural space as a result of penetration or pillion chest trauma. Accumbens, a high percentage of thorax injury can result in a hiding blood loss, like in this picture. Filial chest is a life-threatening medical condition that occurs when a segment of the rib cage breaks due to trauma and becomes detached from the rest of the chest wall. Two of symptoms filial chest are chest pain and shortness of the breath. Loss of stability of chest wall as a result of multiple rib fracture or combined rib and sternum fracture. When these occur, one portion of the chest has lost its bony connection to the rest of the rib cage. During respiration, the detached part of the chest will be pulled in on inspiration and blown out on expiration, meaning, or the word of it, paradoxical movements. Normal mechanism of breathing are impaired at a degree that seriously jeopardizes ventilation, causing dyspnea and cyanosis, like in this picture, filial segments, and this is with inspiration in this area and expiration in this area. Pulmonary contusion, also known as lung contusion, is a bruise of the lung caused by chest trauma as a result of damage to capillaries, blood, and other fluids accumulate in the lung tissue. Excess fluid interferes with the gas exchange, potentially leading to inadequate oxygen level hypoxia. Abuse of the lung parenchyma thus results in leakage of blood and edema fluid into alveolar and interstitial space of the lung may not be fully developed for 24 to 72 hours. like in this picture, thorax injury. Finally, we will talk about cardiac tamponade. Is a serious medical condition in which blood or fluid fill space between the sac and encases the heart and the heart muscle. This places extreme pressure on your heart. Pressure prevents the heart's ventricle from expanding fully and keeps your heart from functioning properly. Compression of the heart as a result of accumulation of fluid within pericardial space caused by penetration injury, metastasis, and other disorder like in this heart healthy, and this is Tampeduna in this space. Thank you for good listening to me, and I hope you are enjoying.
Assalamu alaikum. My name is Abdurrahman Sami Shawan, and I'm going to talk about the diagnosis and how can we diagnose the chest injuries. We can diagnose the chest injuries by several ways. We can do it by chest X-ray, chest CT scan, EFAS ultrasound, or by pulse oximetry, or by the lab tests. Lab test is like, for example, blood testing, including ABG, does not have much utility in making the diagnosis, yet it should be requested in the likely event that blood transfusion is needed. As we said, we can diagnose the chest injuries by chest X-ray. All chest trauma patients should receive a portable chest radiograph. However, the sensitivity of chest radiograph is only 65% for detection of acute traumatic injuries such as hemothorax or pneumothorax. Hemothorax, when the blood enter the lungs will filled with blood, and pneumothorax when the air enter to the lungs. And there is some cases that the blood and air will occur. It's called hemopneumothorax. We have also a CT scan. CT scanning has much higher sensitivity than the chest X-ray for detection of acute traumatic chest injuries. However, obtaining a chest CT requires transportation out of the emergency department, and obtaining images can delay care. We have also EFAST ultrasound. EFAST protocol is tool using an ultrasound examination in a trauma setting to detect free fluid like bleeding, as we can see in the photo here, the EFAST ultrasound. Recent studies have also established the utility of bedside ultrasound, specifically the EFAST exam. In the diagnosis, the management of several acute chest injuries, such as hemothorax or pneumothorax, and in some cases, the cardiac tamponade. And we have the pulse oximetry. This is helpful to assess adequacy of oxygenation and need for supplemental oxygen. The normal range for the oximeter readings is 95 to 100%. Below that range, that will indicate the hypoxemia, which could be an indication of lung damage. In this case, we need supplemental oxygen to help the patient. Thank you.
Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Abdurrahman Sayari, and I will talk about complication with the stab wounds in the thorax. The thoracic cavity contains three major anatomical systems: the airway, lung, and the cardiovascular system. So any penetrating trauma can cause significant distribution to each of these systems, that can be life-threatening unless rapidly identified and treated. So we will mention some of these complications. Pneumothorax is an abnormal collection of air or gas in the pleural space, separating the lung from the chest wall, which may interfere with normal breathing, causing the lungs to collapse. So the complication could be hydropneumothorax, which is the presence of both air and fluid within the pleural space, and tension pneumothorax, which causes complete collapse of the lung onto its helium and the shift of the mediastinum to the opposite side. Hemothorax is the presence of blood in the pleural cavity. In hemothorax, I would say it's the same concept of pleural effusion and pneumothorax, but in pleural effusion, water leaks into pleura, and if it's air, it's pneumothorax. If it's blood, it's hemothorax. Its complication could be cyanosis and hypotension due to loss of blood, and the accumulation of pleural blood forms a stable clot. Cardiac tamponade is a clinical syndrome caused by the accumulation of fluid in the pericardial space, resulting in reduced ventricle filling and subsequent hemodynamic compromise. The condition is a medical emergency, the complications of which include pulmonary edema, shock, and death. Pulmonary edema is a condition caused by excess fluid in the lungs. This fluid collects in the alveoli, making it difficult to breathe. Shock is a life-threatening condition that occurs when the body is not getting enough blood. Lack of blood flow means the organ do not get enough oxygen and nutrition to function properly. So it's fatal and life-threatening condition that will lead to death. Pulmonary contusion is injury to the lung parenchyma, leading to edema and blood accumulating in the alveolar spaces, and loss of normal lung structure and function that could cause pneumonia and ARDS. Pneumonia is inflammation of the tissue in one or both lungs. It is usually caused by bacterial infection. ARDS, or acute respiratory distress syndrome, is a life-threatening condition where the lung cannot provide the body's vital organs with enough oxygen. It occurs when fluid builds up in the alveoli in the lungs. Thank you.
Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Abdullah bin Khatla. I will talk about treatment and surgery of thorax injuries. Pneumothorax. Traumatic pneumothorax is air in the pleural space resulting from trauma and causing partial or complete lung collapse. The symptoms of pneumothorax include chest pain from the causative injury and sometimes dyspnea. Diagnosis is made by chest X-ray, and the treatment is usually with tube thoracostomy. We have three types of pneumothorax. The first one, closed pneumothorax. The second one, open pneumothorax. And the last one, tension pneumothorax. We go to the first one, closed pneumothorax. Air accumulates in pleural cavity through small rent in the lung due to fracture traps. Such rent in the lung subsequently closes and is known as pneumothorax. Closed pneumothorax mean pleural pressure is negative. Now we go to the second one, which is open pneumothorax. Open pneumothorax develops when the skin and partial pleura are broken in an open injury. The pleural cavity communicates with the outside air, which is sucked in and out of the chest during respiration, often quite audibly. Open pneumothorax, sucking chest wound, air enters pleural space, ventilation impaired, hypoxia results. We go to the third one, tension pneumothorax. Tension pneumothorax develops when there is an oblique opening into the visceral pleura, which acts as a flap valve. Air enters into the pleural cavity during inspiration, but can't escape during expiration. We have a needle for tension pneumothorax, wide bore needle inserted into pleural cavity into second intercostal space, 1.5 inch lateral to sternum. And we have bilateral
tension pneumothorax. Bilateral tension pneumothorax can be defined as cases where no tracheal deviation is detected in chest X-ray and symptoms may be equal bilaterally. This is the picture, and we talk the last point, which is the treatment. Treatment will depend on the severity of your condition. It will also depend on whether you have experienced pneumothorax before and what symptoms you are experiencing. Both surgical and non-surgical treatments are available. The treatment of closed pneumothorax, no active treatment, air gets absorbed. The second one, open pneumothorax, closure of the chest wall wound. The last one, tension pneumothorax, required urgent surgical innovation. Wide bore needle inserted into pleural cavity into second intercostal space 1.5-inch lateral to sternum. This is followed by underseal intercostal drainage. Thank you so much.
السلام عليكم ورحمة الله وبركاته. I am Nawaf Al-Asbali. I will provide some instruction for first aid for thorax injury. First, if an objective is still pretending from the wound, do not remove it. This can make the injury worse because if there is a knife or any stab wound, if you remove the object, it may lead to more bleeding, hard bleeding, that may lead to death within minutes. Call your local emergency service immediately. If no emergency service are available, get injured person to hospital as soon as possible. Follow any step that emergency service operator gives you. You may be directed to do the following. Before even you touch the wound, for your protection and patient protection, sterilize your hand with soap and water, put on gloves or other hand protection. Remove any loose clothing or object covering the wound. Do not remove that stuck to the wound. Do not remove any object that stuck to the wound because it may injure the capillary. Keep a hand over the wound while preparing a dressing. Find a chest seal or sterile medical grade plastic or tape to seal the wound. If possible, ask the patient to breathe out to release any excess air. Place a tape, plastic or chest seal over any hole that sucking in air. That will prevent bleeding and prevent the infection. Secure a tape or seal with exhaustive dressing. Remove the seal if you notice any symptoms of tension pneumothorax. If you will see the patient's really hard to breathe after you putting the seal, maybe you have to remove it. So what is our take-home message? A thorough comparison of the anatomy and function of the thorax will help identify, differentiate, and treat plethora of pathology can occur within the thorax. Some injury damage the ribs and chest and muscles. We can diagnose this by chest ray or chest CT scan or EFAST ultrasound or even lab test. And the important point in the first aid, do not remove an object that pretending from the wound because we don't want to make the situation worse. And I want to thank our group leader Abdurrahman Sayyari and our data collector Muhammad Al-Shehri. And we want to thank our group member Abdul Malik Al-Qasim, Abdul Rahman Al-Shahwan, and Saud bin Talib, and Abdullah bin Khatlah, and Muhammad Al-Uraini. And we want to thank our doctor Muhammad Jum'ah for his valuable instruction. Thank you all.